Good morning, everybody. It's Dr. Bertolino, the head doc from Smooth Solutions Medical Aesthetics in Williamsville. This is another reel on our frequently asked questions series. Today we're going to talk about liposuction and liposculpture. And the first question that I always get is, what is VASER? Well, VASER means vibration amplification of sound energy at resonance. That's a mouthful. Basically what it is ultrasound assisted lipolysis. Lipolysis being the breaking up or the gentle breakup of fat into fat cells, adipocytes, which can be used again in certain situations. Second question I get asked is, what is micro air? Micro air, this top machine, is basically power assisted lipo, which is a vibratory cannula. Maybe we can show you that. A cannula that kind of looks like this. So you can see they're very small instruments going through very small punctures. In any event, we use them in combination at times to get the definition that we can try to bring out in a person depending on what their body allows us. What is tumescence? What is tumescent lipo? We've gotten question for that. Tumescent lipo basically is a saline solution that hangs over here. Looks like a liter of IV fluid in an ER, and each liter of solution we put medication. What do we put in? We put in anesthetic, lidocaine, 2% lidocaine. We put epinephrine, which helps vasoconstrict the capillaries, prevent bruising, and sodium bicarb as a buffer, and it also helps with anesthesia. And we place this fluid into the area of concern that we want to break the fat up. So what is the mechanism? I get asked, how does the fat get broken up while you're sitting there or lying there pretty comfortably listening to music? Well, in every single liter of solution, in every fluid in the world, H2O, oxygen in the form of bubbles. So in a liter of solution, you're going to have millions of little oxygenated bubbles. Those bubbles will be placed with the fluid to anesthetize the fat, shrink the capillaries, but that fluid and those bubbles will be the mechanism to gently break the fat up once we put in VASER, which is vibratory, and which is ultrasound. The ultrasound wave, going 36,000 cycles a second, will expand each bubble, and those bubbles become the little crowbar, the mechanism to break the fat into adipocytes, adipose cells, small cells that again we can reuse or get rid of. Another question is, what is liposculpture and lipo360? Well, what is liposuction versus liposculpture? Let's put it that way. I guess liposuction is sucking out big areas of fat, maybe in morbidly obese patients, to take huge amounts of volume of fat out. Liposculpture is basically taking out small pockets of fat in the right candidate to create a more anatomic, more athletic at times body. So you have to understand that even though we're sucking out the fat in every case, the sculpting is with the cannula and with taking out fat and trying to shape the body to make it look more presentable. And what is lipo360? Well, that's a term that comes up all the time. It's doing a trunk 360 degrees around. If it's a male trunk, we do the breast, we do the abdomen, we do the love handles. If it's the female trunk, we do the abdomen, the love handles, and the back by the S-curve near the buttocks. So you're getting a 360-degree fix. So we've been doing this program and using combination therapy for some time now. I've been a Vaser enthusiast since 2007, and microwear we've had now for at least the last 5 to 6 years. We find that the combination of breaking the fat up with the Vaser and then using the power-assisted device to more adequately suck out the fat brings down the patient's, brings the operative time down. It takes less stress off me, and it takes less stress off the patient. So we can actually wrap a procedure up in no time with the patient under mild sedation, no general anesthesia. So this is a wonderful procedure. You will have to wear a contour garment for approximately 1 month. And that's a part of every procedure with whether it's liposuction or liposculpture. And you will be able to go back to work within 24 to 48 hours. So it's a wonderful procedure. We'd love to see you. Come look at our gallery on our website, and you will see some of the bodies we've changed. In any event, thank you for listening. I'm the head doc, Dr. Bertolino at Smooth Solutions Medical Aesthetics, 716-633-6100, smoothsolutionsmed.com. Thank you. Come and see us and get the look you desire. Have a nice day.